Well, welcome. We've all been waiting for this day, have we not? Game one of I don't know how many game series. The winners will be people who live in Minnesota. That's our goal here. So it is. It hailed in Anoka today. That may be a good or a bad sign. I don't know. Big hailstones. Senator Liebling is remote, and Representative Liebling and Gomez are remote, but I'm glad we have three of the House conferees here and the rest of everybody here. We do have a quorum. We're not going to be voting on anything today, so it's not so relevant. Just to give you can you not hear? Okay. Anyway,
we can
hello
hear
everybody.
You online, Senator.
All right. Anyway, so welcome to the game one. Oh, we already did that before. This is different. We're not used to this room, are we? So we've been in the other room before. Anyway, so it's good you're all here. We only have a little bit of work to do. We just have a 900 and a 500-page bill to conferee. I don't know how hard that could possibly be. There's so much commonality in terms of the English language, a lot of uses of the word "the," and some, and some conjunctions, which I think we can build on. So the plan for today is we need to quit by about 4:30. We might take a stand-up break. We'll see what the House is going to do about going into session. Hopefully they can hang around. We do have a lot of work to go through. The general plan is that we're going to be here Monday to Thursday this week at 1 o'clock. I don't know that we have any morning stuff figured out yet, but for this week it's going to be 1 until whenever. And so today we're going to go through, I'll just give you the menu for today. We're going to go through the long-term care money and some Senate-only policy, our substance abuse, and then work on some same and similars. And if we get through that, we'll look at some Senate-only random policy. Tomorrow the plan is that Representative Liebling will go through the spreadsheet, and we'll talk about that since they have more items than we do. We thought that made sense. And then whatever else happens then. On Wednesday, the plan is Senator Utke and his team will walk through the Senate-only health stuff, and we'll see where we go from that. And Thursday, I don't know. And then we're not going to be here Friday and Saturday. There's something going on in Rochester. I don't know, some event of some import that we might be at. So, no, because it's on us. So with that, I just wanted to give maybe the four chairs a chance to say hello, and then we're going to move right into our work. So Representative Liebling, do you want to say hi?
Yeah, well, thank you so much, Senator Abler. Pleasure to be working with you. And you're so right. We have a lot of conjunctions in the bill. I hope we can build on the conjunctions and get a bill get together and get conjoined, I guess would be the word. And we do have a lot of work to do in a very, very short time. So it's going to be quite a challenge. I just would say to the public that I'm sure both our teams are going to be working very, very hard, even when we're not actually here in a conference committee. A lot of the work is going to be going on to try to reach agreement on some items and educate each other on our provisions and so on. And then we're going to do, as you said, thanks for kind of laying out what the roadmap is in terms of conference committee. But our staffs are working very hard. Everybody is going to be really putting pedal to the metal here to get this thing done. So thanks for starting us off, Senator Abler.
And I'm glad you mentioned the staff, ours, and to the revisor's office and our nonpartisan. They have worked very hard to get the stuff together for us today. So much content. Senator Utke, do you want to say hello?
Thank you, Senator Abler, and welcome everyone. And I think when we get to Wednesday and talk about what's in the Senate health part of the bill, it's no different than what we see in everything else. Workforce is the #1 item this year, and we will all be hopefully on the same page there. We've got a lot of challenges around the state, and I think in this bill you'll find a lot of things that can help that. So I look forward to working with everyone and see what we can do to make life a little easier for those out carrying out the mission in our rural communities and across the state.
Well, thank you, and Representative Schultz.
Thank you, Senator Abler. I'm Rep. Jen Schultz. I represent District 7A, which is part of East Duluth. And I'm excited to be in conference committee and to do great things for Minnesotans. I just want to remind the public that our target in the House was only 2.4% above our base spending, and there are a lot of priorities and needs in this state. And unfortunately, coming out of conference committee with a lower target in the Minnesota Senate, we're probably not going to be able to fund all of the needs, although they are great, and we heard a lot from constituents this session, and we have a lot of bipartisan support for part of the bill. But that's what we'll be doing here in conference committee, is to find out where we have agreement and where we can compromise to get good things done for Minnesotans.
Well, thank you very much. And trying to sort out how to even start at all this work, it made sense to me just to kind of go with what we've spent most of our time on and just review it for the sake of the public and the House conferees as well. And we have a reasonable amount of time set aside for this, and so we haven't really choreographed a lot of this with our nonpartisan, but maybe if we're going to talk about some of the math, and maybe if Mr. Monahan and Ms. Hoffman and on our part, just when we cover a certain topic, if there could just be like a brief summary of how like what that amounts to, and it would be more accurate than if I said it. So like, for instance, on the DWRS, just the elements of that, I know it's someplace in the range of 8%, how we spent the $253 million. So you can do that off the top of your head, right, Mr. Monahan? What's that? Well, I know, but, well, whatever. So I'll just do the best I can, then. If people have questions, we'll take it up. We're at a disadvantage that nobody has all the paperwork yet. But anyway, I just thought it would be interesting to go through the kind of money that we have in our bill. Well, and I think everybody is well aware of the crisis in group homes and nursing homes, in the non-emergency transportation, in home care, and assisted livings, and everywhere. And I think that both bills reflect an interest in that. In the Senate bill, which I'm mostly going to emphasize for now, we spend $1 billion over 3 years working to address those problems. And the money goes pretty quick, and if anybody's been following this, we had a proposal to give $200 million in $1,000 bonuses. That actually, when you give them to 200,000 people, that's 50 cents an hour for a year only. So $200 million goes awfully quick, but I'm still confident that if we could ever get the $1 billion out of this conference and into law, that it would truly stabilize the industry and keep things on a level field where they could go. And with that in mind, and I think people are pretty much aware that have been watching this, but in the DWRS, we put $253 million, it's a little backloaded, but in an effort to get money into the group homes and the day services and the other places where they were just about to collapse. And it's hard to even judge what the amount of increase is percentage-wise, but my best guess is someplace in the range of 8%, and which I think will make a real difference. There's a couple different elements of it which I will not, go through now, but it seemed like a thoughtful approach that I will discuss more when we get more deeply in the money discussion. On the nursing facilities rate increases, that's someplace in the range of 12 to 15%. I know it includes $2 an hour, basically for a lot of the workers, and we shrunk down, we gave inflation for the time of delay, and then the indirect cost, which I think is really going to help. We've all sat through enough stories. I debated having witnesses and testifiers, but I don't think we're going to do that. People are just so well aware, particularly the people in this room and watching at home, with some of the challenges where nursing homes and all these places can't attract staff to stay open, and it's backing up things into the hospitals, and so that's pretty well known. Elderly waiver, there was actually some commonality on that. We put a total of $133 million into that, which may well be in the range of a 20% increase. And also the floor, where we're trying to reward companies that have taken care of a high number of people on waivers. And we fixed kind of the glitch from before, if you don't know that. where we said if you have 50% elderly waiver, but 80% altogether, then you can get the bonus. So anyway, I meant to allow anybody to ask any questions offhand as I go through these different items, but so I went against my own little idea, but any questions from the House about any of those? Representative Pinto? Oh, no, just the button.
Okay. Sorry, house guy over here. So still getting used to the room. I'm really glad to be here, Representative Dave Pinto. Question, can you just talk about what the current wages are? I know they're quite low for these different occupations, and what the educational qualifications are for them. But I'd love to get a sense. I know that they're quite low and need to be increased. And so just, I don't know if you have information about that, Mr. Chair, or have somebody who does.
Well, sure. We celebrated, Representative Schultz and I, last year. We were so happy. We were getting close to $15. And then this incredible overnight inflation happened, and now $20 is the old 15. And unfortunately, there is one case where we might get to $20 with one of the PCA changes we made. But the training requirements, how long does it take to be a CNA? A few weeks, I think. So a lot of these, particularly on the entry level, where the pay is the lowest, is the greatest challenge. Not so dissimilar to some things you've been working on. And so, but without those entry-level folks, it's pretty hard to function. Is that good enough for now?
And so, Mr. Chair, back to the first part, so around 15 to 20, is that sort of for these different occupations? I'm just trying to get a sense as to sort of what it is.
On the entry level, you hope you get to 15. It's right. 13, 14. I think in some areas even lower.
Okay. Thank you.
Yeah.
Thank you. And
McDonald's, I mean, in my town, it's $15, you get a $500 hiring bonus. In other towns, it's even higher. So anyway, so thanks for that. And then on the PCA rate increases, we did two things. We took the governor's number and doubled it, which, Representative Pinto, we thought that gets it closer to 11%. And those are just like the backbone of the industry in so many ways. But there's also a phenomenon where some individuals need more than 10 hours a day. 3,000 people need more than 10 hours a day. And I think it's 500 people need more than 12 hours a day. And so in our bill, we gave them enough money to get them up to $20. And so there was a discussion about having even more increments. The higher the need, the more you might get. And it turns out that that's logistically very difficult for DHS with all those different rate things. We had meetings about that, and it would make your head hurt to sit through some of those nuances. So I'm glad you missed that, Representative Pinto. But anyway, so that's really important. Not emergency transportation, and I do not know the rate increase on that. We followed, the House also has the gas money, and there may be some technical things to work out with that. But we also gave, I think, $6 million a year of rate increases. And ironically, those are some people that are very low income and very challenged, and they can't get to their doctors, and across the state, again, that's on the verge of collapse as well, so we thought that was pretty good. The homemakers, the home care providers, which is really, in my mind, one of the most important things to have. We gave them a $90 million increase, which increases their pay in the range of a third, which again gets them close to $20. We raised the lower category as high as we could go based upon federal guidance, and then put the rest into the general rate increases. And if you can, as you well know, I mean, this is not news to anybody watching today, but if you can keep them in homes, you don't have to put them in somewhere else. And then this homemaker thing, Senator Tomassoni had a real passion about that, and we spent, I think, $7 million on that. The homemakers, that is the lowest paid service in the whole array of services. And then the ICF DD raises, they have just been so challenged. And there's two categories of those. One is the level A, which is the ambulatory group. The average pay in that group was $200 a day. We actually, in our bill, raised it to $300, which I think is a good way to keep those intact. Some of those folks have lived there a long time. ICFs are not a growing industry, but the people there really like the stability, and they provide a real need. Some of those cases are quite severe to serve. And then on the category B, the average of that was 300, we made it 400. And so this is a meaningful increase. Last year, we gave a 5% increase with the help of my good colleagues here. And one thing I did not realize is it was the disparity in as we gave the money, we should have given a flat number instead of a percent. So if you're the lowest already, you got the lowest increase, and if you had the most, you did well by that. So those are the big items of spending in our bill. Again, any questions from the House? Yeah, Representative.
Thank you, Senator Abler. So those are all great things, and we have many of those items in our bill, but I will note that given a budget target, some of those items have very large tail costs, meaning the costs are very high in 2024 and 2025. And with the DWS, I know that's not part of our budget resolution target, but we do have to be mindful of that spending and what it will do in the out years in terms of our ability as a state to balance our budget. Second, I just also want to note that some of those items, like for nursing facilities and for the disability waiver rate system, do have automatic inflationary increases or competitive workforce factors, so we can try to increase, those reimbursements are pegged to inflation and the increase in wages using the Bureau of Labor Statistics data. And the other items, such as elderly waiver and homemaker rates and PCA wages, are not pegged to inflation. So we have to take action here in the legislature to increase those reimbursement rates. So those, I think, are a priority because there is no inflationary factors in those items. And I think that those are a priority for my caucus in the House, and I hope for the Senate as well.
Well, I appreciate that. And, you know, part of us going through this now is to create the discussion. And I'll just yield to anybody else on the other side. All right. Just a comment, and today is kind of like a, you know, get acquainted, walk through things, and get the feel of everything. However, even nursing homes, you know, we've done all this work, and in 2015, there was a big change that has made quite a bit of difference, but still it's not working. And as we look at just, nobody planned on COVID coming, and it was rickety as it was. And then with all the challenges about closures and, you know, just all the health challenges and staff and everything, it's just been, I hate to, well, it's the perfect storm. But it really was. And so it was the opinion of the Senate, at least in my judgment, and with a strong, you know, support leaving the floor, that this was a really critical issue, and perhaps amongst the most critical, critically urgent things to attend to. And so that's how the numbers turned out. And if we have to pay for some tails, I think it was the opinion of the Senate that that's probably a good place to put them. So anyway, Mr. Albrecht, did you want to say anything? Dennis is remote. Oh, if we have questions. Any questions for Mr. Albrecht? All right.
Yeah, Mr. Chair, I'd like to just make a.
Oh, sure. Yeah, sorry.
Here.
Yeah, please.
Yeah, I know this is an awkward.
Well, and Tina, if I don't see you, just speak up, okay?
I just did.
Yeah.
That's great.
Well,
Thank you.
hey,
Thank
by
you
the way,
very much.
Yeah, go ahead, Representative Liebling.
Okay, well, I just wanted to add, I think we all recognize that there's a real challenge, and I think we could all really agree that we want people who need care to get it. And I hope we can also agree that we want the people who are the hardworking people who provide the care, we want them to have living wages. But I do think that one thing we need to say in this conversation and really acknowledge is that we have a workforce shortage that is not just in Minnesota, it's national, and maybe it's international, and it's driven by demographics. And so, you know, we, of course, if you don't pay people, they're going to go to other industries where they can be paid more. That's just, it should go without saying. But there's also a point at which we have to really think creatively about how to deal with these challenges, because money will never solve them entirely because we can't create the people. And so I just, you know, it's true that there's been inflation but I think that a lot of what's driving up wages is not just inflation, it's shortage of people and the need to pay higher wages to bring people from and keep them from going to other industries and other situations. So this is a really complex issue, but I just wanted to put out there that it is one that I think everybody cares about, but we will never have enough money to do all the things we want to do. And one of the big tasks that we're going to have here as a conference committee is how to prioritize and make sure that we get the most care for the people who need it the most and for the most people with the limited resources that we have. And that is quite a challenge, especially given the complexity of this system. And what Chair Schultz was mentioning about some of the systems and people that we're talking about here already are on a different system where they get automatic inflationary increases and others are not. And that's just part of the complexity we're wrestling with. But I just wanted to say this year's theme seems to be workforce. And how do we deal with that? Because just demographically, we're in a world of hurt and we're going to be for some time. So thank you, Mr. Chair.
Sure, Representative Schultz.
Thank you, Chair Abler, and thank you, Chair Liebling, for that comment. But in the House bill, we do have close to $500 million to address the healthcare workforce shortage. And this includes things like loan forgiveness, retention bonus payments, money for programs in education to develop our pipeline for our healthcare workforce. So we have a variety of tools that we're going to use and leverage to address this healthcare workforce shortage that is, as Chair Liebling said, across the country and affecting our providers in Minnesota. And that's been a big priority for the House HHS committee members.
Representative Pinto.
Thank you, Mr. Chair. I'll both note something and ask a question. What I want to note is just, and I'm sure we'll have discussions about this, about the importance of childcare as a connection to that workforce shortage in long-term care and nursing homes. A massive challenge that folks are experiencing in those sectors are because of the challenges, thank you, in childcare. But my question for you had to do with, we talked about the impact in this year and then the tails. Chair Liebling had asked about that. Does the Senate at this point have a position? I'll wait for the chair. Does the Senate have a position about the so-called deep tails, about 26 and 27? I remember that being a discussion in the negotiations last year, and treating some parts of the budget differently than others in terms of that impact. I don't know what the impact is of these proposals in those out years, but is that something the Senate has taken into account? And is there a sense as we're starting things out about where, how to think about that? Thanks.
Well, I appreciate the question about deep tails, and I have a feeling that we might discuss childcare at some point. I just have a sense, I don't know, call me Karnak if you remember old Johnny Carson. It's our judgment that if you look at the spreadsheet that the future tails are reflected in 25. And we're not aware of any what they call asterisk where there's some ballooning. And so we were pretty conscious about that. So we can that'll be more of a tomorrow question to kind of look when we go through the spreadsheet. So if that's helpful. And so just, this is what the side-by-sides look like. So you could have one of those. Let's just make copies of it. Oh, okay. Yeah, we're not doing that yet. Okay, well, very good. Representative Liebling, I don't know if it makes you nervous that we're doing telepathy a little bit, so that's kind of cool. Next thing I wanted to talk about is some of the Senate-only policy, and part of what we were doing in that, and we had to constrain some stuff because it cost some money that we didn't have, but is to find a way to make the staff that we have more effective and more efficient and maybe need less and help them be more effective as they do their work. And there are some money policies like driving PCAs and parents with the 40 to 60 hours, which are not part of today's discussion. But I think as a group of conferees and as a room full of people who care about this stuff, the more we can find ways to streamline the operations and get rid of some barriers, the better.
And Mr. Chair, if I could just interject.
Oh, yeah, there.
back
Oh, hi.
One second. Yeah, sorry. I should note that the House has floor session at 3:30 today. And I just want to put that on your radar. We could probably maybe go a few minutes over, but the members are going to need to get over to the chamber, those who are in person. So just want to put that on your radar.
All right, well, we'll do the best we can, so.
Thank you.
Right, I just, yeah, so this is online, so I was just going to reference it. This looks like this. It says SF 4410 Conference Committee Senate Policy dated 5/5. It's online. It's just the one I'm going to be talking off of. I don't think that you have one of those, but it would be, you can go to the Senate page and it should be on there. It just got posted just now. And then there's a similar one called March language from nonpartisan summary. So anyway, so I just wanted to just go through some of these ideas. And again, if people want to react to them, they can. And if someone wants nonpartisan to go into more detail about any of these, they're pretty well versed in these. So a lot of these come from Article 8. And so the first one has to do with talking about capacity. And we have talked about this for a good long time. And in the Senate bill, subject to zoning requirements and actually the agreement of people living there, we thought it made sense where it makes sense to allow ICFs to go from 6 to 8 persons and then group homes to go from 4 to 6. This is within the moratorium numbers, not to create more beds, but to let people consolidate rather than just collapse. And there are some individuals who would prefer more people in their home, and some who would not. If they did not prefer, then they would not have to get that. So anyway, any comments about that? So there was some SED workforce training, which was pretty minor. And then we talked a lot about service terminations, where people were caught by surprise, where there's a process, you have to give 60 days notice, and then all the different agencies and groups will work together to get that done. In some cases, that wasn't happening at all. The county didn't know. The ombudsman was not ever officially informed. We, in our language, inform him or her about that so they can begin to work. And in an effort to help soft land some of these individuals and keep them out of facilities, which is where the gravity tends to take them. And that's spelled out there. Did you find it? I just emailed it to Patrick. All right. So you're waiting for the book to come out? Yeah. I just emailed it to Patrick. Did you email it to Patrick? It's also on the Senate page, too. Oh. Oh, it's not. You want to do that? I sent it to Patrick. He'll send it around. Sweet. Okay, well, I'm sorry about the logistics. A lot of the stuff has been created pretty recently and edited and anything. Anyway, and then we spent a fair amount of time, that should have been part of the SED thing. Am I in the wrong? I'm going to, yeah, well, I'm going to talk about RCOs later. That should be on the other list. So then there's talking about nursing assessments for customized living, and the brain injury and CADDY, that was being left out, and we included that as well. We just thought it made sense to put those in. And then this came from Senator Fate and his crew. They, and it came about as an issue with the case manager evaluations. The counties will subcontract with case managers that aren't county employees, And it's not clear that the county really is in charge of what happens there. Obviously they are, but they didn't seem always aware of that. And so we thought the simplest way there could just be an annual review about how is it going when the min-choice assessment happens. Not necessarily part of the min-choice assessment just on the same time that they could feed back. And so it seems like you'd like to know. And otherwise, there was a circumstance in my county that it was just a whole mess, and it seemed like the case manager was not paying attention at all. The next one is the IDBI, some policy language, just that they have to work with stakeholders. Senator Hoffman is much more versed on this next one, co-signed leases. Part of the challenge is to let people be more stable with their housing. And when Senator Hoffman is available, he can talk about that. And some of these are just simple. The customized living moratorium exception, when you relocate to a new setting, a new place, it's the same people, and you have to get a new credential, and it's not easy. Some of the stuff is just not easy. And given the challenges, there was a view of the Senate and I presume the House, that things should not be hard. Let's not make it any harder than it has to be. Excluded time, as mentioned there, substance use disorder, payment reduction. And so there may be a simpler way, but we're trying to find a way to make some of this easier. And then informed choice upon closure, that to engage individuals better. This is just a sign, this is a problem of the times where we even have to worry about closures. The time was when I first got here, we were so happy with then Representative Goodnow that we were able to open up the waiting list on the waivers. Like, oh, you're in a waiver, all is well. That's not true now. Just getting a waiver slot is almost like having almost like expired gift card. And it's not, it has to mean something because we all care about that. So that's part of what that's about. And then we did a little work with FAME. Some of that was pretty small. And then also on the workforce thing, when Ramsey County came and Randy, somebody was here, and we were just very impressed with their commitment on the homeless side, how they were talking about helping people get into the workforce. And I thought that there should be a way to encourage that. And that's the point of this last one, that SED providers and homeless providers would find a way to help people where it's appropriate to be attracted into work. So, any questions about any of this stuff? All right. Well, very good. So let's talk a little bit about, so that's the end of kind of the long-term care piece. We spent a good deal of time as well talking about substance use. And I don't know if you've all seen it, but there was just an ORAC report that came out just a few days ago. And talking to Senator Eaton as we were working on some of this, she sat in testimony with one of our projects that I'll talk about, saying every year the number gets bigger. And the chart, it was just, you look at how it's going. We spend all this money, do all this effort, have all these well-intended people in this audience and at home and at the table, and we're losing the fight. It's going up more every year. And if you happen to be a tribe or in that group, it's even just disastrous. And if you're, African-American, it's not a lot better. And that's not what anybody means. We were having a hearing with March one day, and we ran into this fellow named Jake, who's the picture on the front here. And his mother was talking about something that she was working with some family, something or other, and then she showed us this picture and identified that as her late son, who had been through 12 treatments, and someone gave him a blue pill, and that was the end of Jake. And it was amongst one of my more shocking, introspective, collapse or emotion moments. And so I've been putting his picture on here every day since to remind me and the people that it's about the people and not about the paperwork. And everybody in this room, and God bless the department, you have to follow the federal stuff, and this is not bad, but you wind up with this kind of binder full of rules to help Jake. And you missed a rule and you're not going to get paid, and so then Jake can't get paid for, and then Jake is gone. And we just had some really compelling testimony across the time. And out of that came a whole effort at substance abuse, some reforms that we thought made sense. And that's another handout, which maybe you have. It looks like this. It says March. Did you send that out? Okay, that's been sent out. It says March language. Anyway, and so I'm just going to, I'm going to just kind of go through this a little high level. But there are some things that just don't make sense that we've made hard. And the providers got together, and they've been working with DHS, and I think we're close to agreement on a lot of these, about how to make it simpler. And in training and in supervision, we had to pass a law. We have to pass a law to allow a guest speaker to come speak. So somebody who's a recovering person in recovery, when he comes and she comes and talks, you can't get paid for that half hour. Like, really? So hopefully we can, I mean, that's some of the most effective individuals. They're sitting there with the counselor or whoever. We talked about policy and procedure manuals. We talked about some paperwork reduction that we're trying to improve upon. Talked about documentation. Sometimes you're in the middle of a crisis and you can't get it done right away. Well, you violated the law, so we give them 24 hours to write the report. And simple things like that. And so on the bottom of the page at Senate Article 11, Section 2, it talks about you have to document the reaction of the client. Like, I don't know, it's sometimes hard to tell. And so I don't know what good it does. Who's reading that? We talked about students going to work earlier. We spent a good deal of time talking about recovery community organizations and how we wish that they could be more accessible and that they would be more equitably approved. And so I'll appreciate the discussion with the House about some of that. We think there's a real problem. And it made sense to have an organization, a private organization, review that back when there was only a couple. Now there's 19, I think, approved ones. There's some concerns about the approvals. There's now some money. There wasn't money before. And so if you get approved, you get the money. If you aren't, you don't get the money. And so we talked about a certification board that could help sort that out. And I'll appreciate the attention of the House as we get onto that. In addition, one of the biggest things we proposed, which was a very strongly oh, by the way, and Senator Wickland was the author of the March bill and worked, and I would just want to commend her. She worked really hard and is still working with all the people in the department to see which of these we can try to get across the finish line. And the final thing we did in the substance use thing, trying to make a real difference, was to get recovery and behavioral health into the light of day at the department. And I'm not going to spend any time figuring out how things got to where they got, but you had enough layers of laws on top, things get pretty well buried there. And it was down 3 or 4 levels in the Department of Behavioral Health. And it was even without a director for some time. And so a lot of us thought it made a great deal of sense to create a new standalone Department of Behavioral Health, which I still think makes a great deal of sense. It was intended to be without cost, without causing any upsets. There's all kinds of departments in Minnesota and across the country that work with these interagency agreements where it works out. And so just to make sure that they had their chance to see the light of day, so that's in the bill as well. So any questions from the House about any of that?
Thank you, Chair Abler. Well, wow, if we go through, when we have the gavel, if we go through everything in our bill, we may not get done by the end of session. So there's a lot in the House bill, and I don't think it's our intent to go through every section highlighting what's in our bill, but maybe we can do that when we do the side-by-sides and spend time talking about what's in our bill, what that's not in the Senate bill. But as you lift up that folder, yes, it's heavy and big because we're doing a lot of great things for people in Minnesota. And so I just want the public to be aware that the House had over 160 individual bills from members brought into the Omnibus bill. So there's a lot of good things in there to make people's lives better and easier and to make the government work more efficiently and to get services to people quicker without all the paperwork.
Representative Liebling, hi.
Yeah, thank you. Thank you, Chair Abler. And I just wanted to make a very general comment, kind of responding to some of what you've pointed out here. And that is that it's, when we want to accomplish something and the law says that we can't do it, then of course, naturally, we want to say that the law is wrong. And, but I just want to put the perspective that we're spending taxpayer money. And a lot of times, we hear the opposite complaint. People like say, well, there's fraud, or the money's not going where it's supposed to go, or, we're spending too much in this area. And then they want to push the other way to have more rules and make people jump through more hoops. So I just want to put the perspective out there. While we all agree that we need to be careful, that we're just not putting rules in place just to have rules, that they are there for a reason, that they're there to make sure the money goes to the right places, that it buys what it's supposed to buy, that it's effective. And we have to do this very, very carefully. Sometimes rules do get outmoded. They don't do what they were supposed to do, including some that we put in place. And we should always be looking at this. And I hope that we will work hard to find the appropriate balance. But, regulation just is not a bad thing. It's there in general to make sure that the will of the people is carried out and that the taxpayers' money is well spent, both the federal money that we're so fortunate to have to help with a lot of these services and the state funds that we know we will never have enough to waste any of it. I think we could all agree with that. So just want to put that plug in, Senator Abler, that hopefully we'll have time to find out what some of the reasons are behind some of the regulations that are in place and decide collectively whether those should be adjusted. But I just want to put that plug in there because it's those rules are really important.
Well, I appreciate that very much, and I think we all agree. And so it is not lightly that the Senate brings forward, these ideas that were strongly supported without regard to any party, just with regard to the policy, but trying to find a way to make it work. And I think that it's been maybe exacerbated by COVID for all the reasons of, all the depression and stress on individuals, which is certainly a factor in the deaths going up, but tragic nonetheless. And so going forward, I'm really eager that we can do that. And just so you know, what we've succeeded in doing with one more section, if there's time after we talk about some of the same and similars, is really the bulk of the Senate-only parts of the bill. And so I thought it would be helpful for the House to understand where we put really the bulk of our time. And our grave concern about the perils of individuals in group homes, nursing homes, assisted livings, home care, et cetera, where we just really put our eggs are pretty much in that basket, and we see that as the critical need of the day. And then most of the substance abuse things you'll notice are policy. There's not a lot of money that we put into substance abuse. I don't think any. These are all policy things meant to streamline what we've been doing in the past, and I'm eager to work with the House members on where there's somewhere to go with that, and maybe Representative Fisher will be part of that discussion about that as well. Any other comments from members? All right. Well, very good. And so at this point, Representative Liebling, you and I were talking about same and similars. Are these ready? Okay. Anyway, so there is a cheat sheet which we're getting copied for individuals. But if nonpartisan staff could go through the index sheet and talk about the items that are similar and that are identical and similar, just to kind of go through. And there's surprisingly small amounts of them. And whenever the sheet comes, like some, there's multiple sections on one line. So there were some bills. They're going to tell us. So if you could walk through the document that not everybody has yet, but just to identify, they're identical, and so it's not anything very controversial. It's not my intention to even suggest we adopt these today, but just to walk through and help people understand what's identical and similar, And then at some point between staff and whomever will agree which is better, House or Senate, or what TA we need to get to clean them up. So.
And Senator, are these being sent out to everyone? I don't think I have the document, as you said, this just came.
Okay, it was just emailed and just posted, and
Okay.
somehow I thought everybody had this, so I apologize about that.
Okay, thank you.
It's actually prepared by House Research and Senate Council, so there you go. So I know that my council is sitting here, and I don't know if you were going to share with the House Council, so I'll let you just kind of, you want to start, Ms. Kavanaugh, or whoever? Thanks.
Mr. Chair, we'll start with Article 1, and we'll just work through this, and they're just...
But not House only, I just want, just identicals. Thanks.
Same and similar
Yeah, right.
is what you're
Perfect.
looking
Thank you,
for.
yeah.
So House Article 1, we're talking the Department of Health Finance. This is compared to Senate Article 13, the Department of Health.
Oh, and Ms. Kavanaugh, let's just do policy now. Let's not do money.
Well, believe me, it won't make a difference. There are no similar sections in Article 1.
But I mean, but going forward, this is just meant to be policy for now. We'll never get, so.
I will.
Yeah, but you can do whatever you want, Ms. Kavanaugh, that's fine.
Okay, so Article 2 is the Department of Health Policy. And that is compared with Senate Article 13, the Department of Health. The first section that is similar, that does not have money, would be House Section 8, and that's compared to the Senate section that was in Article 16, Section 5, and it has to do with eliminating a mandated report for, that was required for the, elevation, myocardial infarction response treatment and outcomes. And the differences there is that House eliminates the posting of the outcomes on the department's website, as well as the annual report, and the Senate only eliminates the report. The next same or similar is House Section 9 and 79 and Senate Section 7. And also the next section, House Section 9 and Senate Section 7. These sections have to do with the hospital construction moratorium exceptions. The first exception, both the House and the Senate have it. It deals with a critical access hospital with an attached nursing home. The only difference here is the Senate exempts any project in the state that meets the requirements of this exception. The House only exempts the one project in Grand Marais, and then they have a study to look at all the other projects within the state. And then there is another exception to the moratorium for Children's Hospital. That is identical in both bills. The next section in Article 2 is House Section 28 and Senate Section 8. And this modifies the definition of palliative care, and there really is only a technical difference between House and Senate. Then we go to Article 3. This is finance, so I'll skip that, even though there's there's 3. Well, there is the, in Article 3, it says that it's a Senate section only in Article 3, Section 10. But the House has it in Article 9, and this has to do with authorizing telephone-only televisits to satisfy face-to-face requirements for payment for FQHCs, RHCs, Indian Health Service, tribal clinics, and certified behavioral health clinics. So that's in both bills. It's similar. It's just the coding. House codifies it. We do not codify it. Article 4 is healthcare policy. There is nothing similar in that. Article 5 is the health-related licensing boards. There are two sections, well, one, House Section 18 and Senate Section 22 and 26. These sections do modify the scope of practice of pharmacists, but they do it in entirely different ways. So while there is the same section that's being amended in both the House and the Senate, the topics are different. House Section 20 and Senate Section 28. These sections deal with temporary requirements governing ambulance service operations and emergency medical services. And the minor difference is the House allows alternate staffing for interfacility transfers, and the Senate does not. The next section, House Article 6, prescription drugs. There is one section that is similar, House Section 56 and Senate Section Article 14, Section 27. And this deals with modifying the criteria and procedures for treating intractable pain. And there are some minor differences in the definition of intractable pain. And the Senate references physician assistants and advanced practice registered nurses, and the House does not. And the Senate exempts these prescribers from civil and criminal action if they deviate from the a higher dosage than what is required or recommended, and the House has that exemption in it. And the next Article 7, health insurance, that is all House only, and that's all I have for my part.
Well, thank you. Mr. Monahan or Ms. Hoffman, you guys can just kind of trade off. If anybody have any questions about that first little cluster? All right, go ahead, Ms. Hoffman.
House Article 8 is the Community Supports and Behavioral Health Policy article. House Sections 1, 2, 4 through 41, and Senate Sections 1 through 9, 15, 19 through 29, 34 through 37, 43, Article 4 of the Senate Section 50, Sections 45 through 47, 49, 53 through 58, 62, and 63 is the Department of Human Services, Community Supports, and Behavioral Health Policy Bill. It makes various technical clarifying and policy changes to community supports and behavioral health provisions related to mental health treatment services and standards, certified community behavioral health clinics, corporate foster care, integrated community supports, et cetera. Almost all of the sections are identical, except House Section 23 is House only. House Section 25 and Senate Section 35 have some technical differences. The House includes additional language in paragraph D for telehealth services via telephone, and the House also includes a retroactive effective date. House Section 32 and Senate Section 47 also have a technical difference. The Senate put them in order, and the House did not. House Section 40 and Senate Section 62 are similar, but the House also includes changes made to Minnesota rules, and the Senate does not.
Mr. Chair and members, House Article 9 is the Community Supports article. It is compared with Senate Article 1, also the Community Supports article. If we limit same and similars to policy, there are no same or similar policy provisions.
House Article 10 is compared to Senate Article 4, both dealing with behavioral health, and this is purely a finance article, so there are no same or similar policy provisions.
Members, House Article 11 is the continuing care for older adults policy article. It's compared to Senate Article 9. House Sections 1 to 7 and Senate Sections 1 to 7 are from the DHS Continuing Care Policy Bill, establishing licensure requirements for remote adult day services. There are technical differences, and the staff recommends the House language. And House Article 12 is the continuing care for older adults finance provisions, and thus there are no same or similar policy provisions.
House Article 13 is Child and Vulnerable Adult Protection Policy, and it's compared with Senate Article 10. House Section 1, 3 through 18, 20 through 25, and then Senate Sections 18, 21 through 35, 37, and 40 through 45 come from the DHS Child Welfare Policy Bill. There's extensive clarifying changes, statutory changes emphasizing relative search, notification, engagement, and placement. All sections are identical except for House Section 5, Senate Section 23, where they're similar. Senate adds language adding or any other relative when a notice or summons is provided. House Section 6 and Senate Section 24 are similar. There's just some technical differences with the placement of new and stricken language. Same thing with House Sections 17 and 18 and Senate Sections 35 and 37. House Section 23 and Senate Section 43 also contain a technical difference where there's just some minor language differences in statute citations. House Section 2 and 19 and Senate Section 20 and 39 require preference for permanent placement with a relative for children with whom parental reunification is not reasonably foreseeable. House Section 2 and Senate Section 20 are identical. House Section 19 and Senate Section 39 are similar. The Senate just includes clarifying language regarding court consideration and what happens if a relative is not available. House Section 26 and Senate Section 46 modify procedures for child maltreatment face-to-face contact. The only difference is Senate adds when possible into the language. And then House Section 28 and Senate Section 48 are identical and require family assessment for documentation. Moving on to House Article 14, which is child protection paired with Senate Article 10. This is a finance-only bill, only article, and so there are no same or similar policy provisions. House Article 15 is economic assistance policy and paired with Senate Article 10, children and family services policy. House Sections 1 and 2 and Senate Sections 16 and 17 are identical. House Section 3 and Senate Section 49 just have a technical difference in the SNAP acronym placement, and these sections allow unemployment insurance information to be disseminated to local and state welfare agencies for monitoring eligibility of data subjects for public assistance. House Article 16 is economic assistance, and it's paired with Senate Article 10, and this is a finance-only article, so there are no same or similar policy provisions. House Article 17 is the direct care and treatment policy matched with Senate Article 12. House Section 1 and Senate Section 1 are similar. They just have some technical differences, and these sections deal with the DHS direct care and treatment policy bill. House Section 2 and Senate Section from Article 16, Section 15 are similar. There's just technical differences. This is also the DHS direct care and treatment policy bill. House Section 3 and Senate Section from Article 16, Section 35 are similar. The Senate simply repeals the reporting requirement, and the House relies on the operation of boilerplate language in the appropriations article. House Section 4 and Senate Section 2 are identical, and it is repealing language. House Article 18 is preventing homelessness, and it's matched with Senate Article 10. And the only policy same or similar is House Section 6 and Senate Section 55, which extends the reporting deadline for the task force on shelter. It's just a technical difference.
Members, House Article 19 is a DHS licensing and operations policy article. It's matched with Senate Article 11. There's one similar provision in House Article 15 and Senate Article 1 related to human services licensing suspensions. Otherwise, there are no other same or similars in Article 19.
House Article 20 is a House only, so there is no same or similar policy provisions. House Article 21 is child care policy, and it's matched with Senate Article 5, and there are no same or similar policy-only provisions in this article.
Mr. Chair and members, and we have the House Article 22 miscellaneous, and there is one section in there that the Senate also has in Article 3. So it's House Section 2 and 20 and Senate Section Article 3, Sections 1, 13, and 15. And these sections have to do with moving the Rare Disease Advisory Council from the University of Minnesota to the Council of Disability. And there are a number of small differences in these sections dealing with how public members are appointed, how the legislative members, how long they serve, and their ability to vote on grants that deal with state money, and the term lengths of members and the ability of members to be appointed, compensation for public members. I think those are the differences there. And House Article 23 and Senate Article 17, these are the forecast adjustment and carry forward authorities. There are some technical differences, and some have money, some don't, but there are technical differences.
And Mr. Chair, members, finally, there are 4 Senate-only articles: Senate Article 6, Senate Article 7, Senate Article 15, and Senate Article 16. And obviously, there aren't any same or similars in those either.
We're going to do something like this. Anyway, so I appreciate any questions on the same or similars, and I believe you did mention there are a great number of ands and ors that are quite in common with us, and sometimes it's an or and they have an and, or the other way around. But anyway, any questions about any of these sections?
Mr. Chair?
Yeah, Representative Lieberman.
So, yeah, thank you. So I was noticing, of course, that we have the opioid settlement in here. I think it was Article 20. And I think we are so same and similar on that I think it already passed, if it's the same thing.
I think so.
And might have been signed into law. So I just want to confirm that, ask our nonpartisan staff to confirm that. And so we're so aligned that we already
There
passed
you
part
go.
of it.
Ms. Caverna?
Yeah, Mr. Chair and members, yes, that Representative Liebling is right. That has passed both the Senate and the House floor. So that's off, that's done.
Something to celebrate.
Yes.
And so,
You can claim it.
there you go. And so, Representative Liebling, we've spoken a little bit, but I clearly, we're not in a position to adopt anything today, but we talked about this, so would it make sense to have the staff look into those same and similars and come back with some suggestions to us?
Yeah, I think it would, absolutely. I mean,
All right.
unfortunately, Senator, I mean, there is so little in the bills that is same and similar that, it doesn't buy us a lot even to move them out.
Well, we'll see.
And we'll see. And I just did want to suggest, I don't know how much you wanted to cover today, but, if you kind of run out of material here, maybe we could go to the spreadsheet and have the nonpartisan staff give us a high level comparison there. I absolutely don't want to have the walkthrough where every single thing gets mentioned because we don't have time for that. But just wanted to suggest that if you are looking for, if you want to fill our time here, if you've gotten to the end of what you wanted to discuss.
Right, I'd like to do two more things, and so it's funny that we don't really have, the policy only that the Senate has is not a very long list, and I thought we could just, go through that. Just so the public, if you were waiting for the 3-day side-by-side discussion, I would suggest you get the summary and sit home and read it to yourself, but we thought that would not be a productive way to spend our time, and so we did the same and similar side-by-side walkthrough. Most of the stuff is tied to money. So anyway, any more comment about the same and similars? And so if staff, I just wanted that to be a public notice that we're going to be working to at least resolve that little bit, and maybe there's a couple hundred pages of policy in that. So if staff would please now look to the Senate-only policy without money and just comment about those through the same document, just kind of leaf your way through.
Mr. Chair, I'm not, you
Okay.
want Senate-only policy?
Right, there's only about 15 sections, or 15, so on this thing here where it says Senate only and its policy, if you could just kind of walk through there with us as well.
So you want us to start over again at Article 1, or you
Please, yeah.
want?
Yeah, if you would. Just briefly, you don't have to go into much detail, but just so that the public and the House can be aware of what Senate only there was. And if it's already been discussed in the context of SUD or the listing that we did on the long-term care community supports thing, you don't have to, just the things that are kind of the miscellaneous ones that are left over from that.
Okay, Mr. Chair and members, Article 1 is fiscal, so we'll skip that. We'll start with Article 2, the Department of Health Policy. Senate only, the first is Senate Section 6, and this exempts certain spa pools from the public pool regulations. Let's see. Then Senate Section 9 is Senate only. That permits a licensed assisted living facility with a licensed resident capacity of 6 or fewer residents to relocate to a new address without applying for a new license. Senate Sections 10 through 12 and 14, Senate only. These sections modify and clarify physical plant requirements for small assisted living facilities. Senate Section 13 permits variances to assisted living physical plant requirements when repurposing a building to meet a critical community need for additional assisted living capacity. Senate Section 21 that modifies the requirement to obtain an MDH recommendation for foreign medical graduates to obtain a J1 visa waiver. And Senate Section 22 creates a temporary expedited pathway to allow unlicensed personnel working in assisted living facilities to become more quickly trained to provide direct care and support. Article 3 is finance. Article 4, healthcare policy. The first Senate-only section is Section 8, Article 3, Section 8, and this adds to the annual Department of Human Services report of provider reimbursement rates. It adds the substance use disorder services, so the provider reimbursement rates that managed care plans pay for those providers that are providing substance use disorder services have to be included in that report. And that's it. Article 5 is the health-related, that's all, that's money. Oh, okay, where is that? Let's see. Where is that? Oh, and, so in House Article 5, Senate Section Senate Article 14, the health-related licensing boards, there is Senate-only Sections 2 and 3 that modify the membership of the Emergency Medical Services Regulatory Board. And the rest is money. Oh, nope, Senate-only. Senate Sections 5 through 13 and 30. These sections create a temporary permit for physicians, physician assistants, and respiratory care therapists. And it also extends the temporary permit period for nurses. The compact, okay. Oh, that's house only. Senate Section 19. Senate only, this permits a former student to practice alcohol and drug counseling without a license for 90 days if supervised by certain licensed alcohol and drug counselors. That's money. And Senate Section 29 permits a nurse who desires to practice nursing in a nursing facility or an assisted living facility, but whose nursing license has lapsed, they're able to submit an application to the Board of Nursing for registration. And I believe that's Article 6 is house only, prescription drugs. Senate Article 7, that's all. I think I'm done.
Mr. Chair, members, House Article 8 is the Community Sports and Behavioral Health Policy article and is matched with Senate Article 8. Senate Sections 13, 16 through 18, and 59 are the previously mentioned substance use disorder workforce provisions. Section 30 and 31 are the Recovery Community Organization sections. And then Sections 38 through 42 make technical changes to the statute governing coordinated care through behavioral health homes. And that is it for Article 8.
Mr. Chair and members, House Article 9 is the Community Supports article. There's one Senate-only policy provision that is not money-related in this article. It's Senate Section 4. It requires providers of SUD and homeless services to incorporate employment services for clients. I think you actually already mentioned that one, Mr. Chair. Those are the only policy-only provisions in that article.
House Article 10 is the behavioral health article, and this is a money-only article, so there are no Senate-only policy provisions.
And, Mr. Chair, members, in neither House Article 11 nor House Article 12 are there any Senate-only policy provisions.
Mr. Chair, members, House Article 13 is the Child and Vulnerable Adult Protection Policy article. Senate Section 12 requires notice to be provided to a child in foster care if a third party applies for or receives that child's supplemental security income benefits. Section 36 requires efforts to be made by a caseworker to visit a child in foster care outside the presence of the child's parents, foster parents, or facility staff, and also requires documentation when such a visit is not possible. Senate Sections 50 and 51 require the transfer of the total amount of aid reductions for the Tribal and Training Certification Partnership and also makes a conforming change. And Senate Sections 53 and 54 extend the effective date for the mandatory reporting for youth recreation programs and also modifies the Legislative Task Force on Child Protection. House Article 14 is the Child Protection article, and this is a money-only article, so there are no Senate-only policy provisions. There are no Senate-only policy provisions in House Article 15 as well, which is the Economic Assistance Policy article. House Article 16 is Economic Assistance, and that is money only, so there are no Senate-only policy provisions. House Article 17 only has same or similar provisions, and that is the Direct Care and Treatment Policy article. House Article 18 is Preventing Homelessness, and Senate Sections 9 and 11 adds a Homeless Youth Provider Repair and Improvement Grant Program.
Mr. Chair and members, House Article 19 is DHS Licensing and Operations Policy. It looks like there's one Senate-only policy proposal. It is Senate Section 3 from Article 11. It allows DHS to use an outside organization to provide data analysis to the Background Studies Eligibility Task Force.
House Article 20 is the opioid settlement article. There are no Senate only, and it's gone. House Article 21 is child care policy, and there are no Senate-only policy provisions in this article.
And Mr. Chair, members, there are no Senate-only provisions in House Article 22. And then there are 4 Senate-only articles. Senate Article 4 is all money-related. Senate Article 7 creates the Department of Behavioral Health. Senate Article 15 is the Minnesota Higher Education Facilities Authority modifications to expand the authority and the scope to allow financing of healthcare organizations. And Senate Article 16 is the Senate's language related to mandatory legislative reports.
Well, thank you very much. I think that's productive. And so Representative Liebling had a suggestion. So this is, I thought this might take longer. It's really hard to judge how quickly something will take. But I thought it would be productive for the House to see where we've, put our efforts and our focus. And I was hoping to get that far today, but since I'd hate to waste an hour. Representative Liebling, do you want to find some way that'll be really clear to help the fiscal folks keep on high level? Do you want to put like a dollar number or something to help them go through the spreadsheet? I think that'd be great to get that out of the way if you're okay with that, because we were going to do that tomorrow. Do you want to give the staff some instruction?
So thank you, Senator Abler. I think our fiscal staff were, I don't know how far we've gotten with working with them to be prepared for tomorrow on doing a high-level overview. I don't know if I want to give them a dollar amount right now and kind of probably throw them for a loop if I was to do
Oh,
that,
sure.
but
Well,
I
we could
don't
take
know,
a stab at it.
well, Mr. Berg or Mr. Harney, are you prepared? Let me just ask if they're prepared. I don't want to, if they're not ready, I don't want to put them on the spot, but if they're ready and they feel like they can do a high level, I just thought it would be productive to sort of explain the differences in how the House and Senate are handling the money and kind of the biggest places that it's going. I mean, granted, we
Absolutely.
have, in the House, we have a lot more provisions. And so to read through every one of them, I mean, the spreadsheet is 35 pages long, so we don't want to do line by line. But Mr. Harney or Mr. Berg, just let me know, are you comfortable doing a high-level overview?
Mr. Chair.
Mr. Berg, oh, there you are.
Representative Liebling.
In person.
Yes, I certainly, I mean, I can do it at a high level by the agency net spending at first, which will only take a couple of minutes. And you can see if you want to go on from there, maybe. I don't know if that is
Well,
helpful.
Representative Liebling, yeah, so I think,
I am prepared.
yeah, so, well, let's try to see if we can get through that. And so Representative Liebling, then perhaps tomorrow, if members had questions about some of those items, would that be appropriate to maybe start off? We'll see how far we get through the sheet, and is that fair? Because I think we may have some questions or things you might want to talk about. Is that fair?
Sure, absolutely. I don't think we want to, we've got our time here laid out, and let's use it and get as far as we can get.
Yeah,
That's
so
all.
Representative Schultz.
Chair Abler, are we looking at the spreadsheet that's dated May 5th?
Yeah, Mr. Chair.
Mr. Berg.
Members should have, there was a posted copy that at the top says 2022 legislative session, HHS fiscal tracking, CC3. The date and time are, yes, May 5th at, I believe, 9:16 a.m. Everyone should
Thank
be
you.
looking at that.
That's an important detail.
Yes, it is. And it is online.
Yeah, so Mr. Berg, if you can,
All right.
is Mr. Albrecht going to share with you, or are you going to?
I haven't conferred with Mr. Albrecht. We weren't exactly expecting to do this, so I don't know
Yeah.
if he's online. I can just kind of highlight the items and maybe not talk about individual money in most cases, just what we have and what the.
Well, we do have an hour, so I mean, I
Okay.
think, why don't you just try to make it
All
fit
right,
into an hour?
I'll start with
and-
just the general fund expenditure. If members,
it's,
just to
it's all
orient
yours.
you to the spreadsheet, the House columns are the middle set, and the Senate columns are on the right-hand side. The second line from the top shows the net general fund spending. The House has net general fund spending of $779,575,000 in 22-23, and $1,676,572,000 in 24-25. The Senate has net spending in 22-23 of $155,318,000, and in the tails, Senate net general fund spending is $698,731,000. And Mr. Chair and members, then if you go, individual initiatives start at the bottom of page 2. The House has an item from the governor's budget that changes the definition of family and child care. The Senate does not include that item. The House has the governor's initiative on preserving American Indian families. The Senate does not cover that item. The House has also got the Family First Prevention Act Implementation Phase 3, which is not in the Senate bill. The House has got the American Indian Child Welfare Initiative planning for the Mille Lacs Band of Ojibwe, which is not in the Senate position. The House has got the Stabilizing Working Minnesotans item as one of the larger ones out of the governor's budget. This is not in the Senate position. The Senate, we come in the middle of that page to the Senate-only provision, which is increasing the MFIP earned income disregard to 60%. That's a Senate item, but not in the House's position. It's a governor's item that is not in either position at that point. Going down to the CCAP max rate recommendation, the House goes to the governor's recommended level, but the financing within that is somewhat different.
Mr. Chair? Sorry.
Yes, Senator Benson.
Mr. Chair, could Mr. Berg call out line number? I know he's trying to be high level. Line number would help as we move quickly.
Mr.
Thank you,
Chair.
Mr. Berg.
Senator Benson, yes. So that last item was at line 193, and I haven't been actually using numbers trying to go through it, but if it's better for, this is a larger item, so maybe it makes sense. The House has got spending of 68.5 million in 22-23 and 274 million in the tails for this. As I say, the governor's financing scheme is a little different than the House's, and the Senate does not include this position. Moving on to page 4 of the spreadsheet, the first item that's in House position is on line 221. This is the governor's item of stabilizing, childcare stabilization and supports. The House has got largely the Senate's, the governor's position, but it's not quite identical if you look at a few of the lines in there, but it's very similar. The Senate does not include that position. On line 235, the House, there's a House-only provision of continuing child care stabilization grants, which have been paid for out of federal money. This sets up state stabilization grants for 30 million in 22-23 and 159 million in the tails. Line 240 is the family friend and neighbor caregivers item. The House, this is a House-only position. On line 253 is a House-only position for the Retain Brain Builders program. Line 257 is an item, a House-only item to develop, directing DHS to develop a cost-based child care estimation model. On line 265 is one piece. We'll come to a number of other pieces related to this. This is a child care IT and data exchange initiative. This is the DHS portion of it. This is a House-only position. On line 273 is a school-based mental health grants item, which is House-only. That's for 3.8 million in 22-23 and 7.5 million in the tails. Again, that's a House-only item. There is a governor's recommendation that the House carries for investing in child welfare prevention and systemic needs that spends 46.6 million in 22-23 and 93.1 million in the tails. The Senate does not carry that item. Going on to page 5, line 292. Is the governor's recommendation on food security. The House spends 27 million on that in 22 and 23 and 8 million in the tails. That is not in the Senate position. On line 302 is the governor's recommendation for building assets for Minnesota families, is commonly known as FAME. The Senate has a smaller position than the governor's, and the House does not include that position. Line 306 is the governor's recommendation on addressing homelessness for Minnesota adults and families. Neither the House or Senate have this item, although we will come to a substantial amount of homelessness funding in the House position later on in the sheet. On line 316 is the Family and Community Resource Hubs Initiative. This is a governor's recommendation. The House has got 14.7 million in 22-23 is actually larger than the governor's, and 37.6 million in the tails. That is not in the Senate position. On line 330 is the governor's recommendation for improved access to mental health services. The House has got this in its bill for $12.5 million in 22-23 and $58.5 million in 24-25. The Senate has a piece of this for $261,000 in 22-23 and $1.4 million in the tails. You can see when you get to the next page, page 6, that the Senate is picking up some, I believe it's adult day services lines there, but not the rest of that initiative. Again, on page 6, line 357, the governor's recommendation for addressing deep poverty. The House carries that for it's $82,000 in 22-23 and $45.5 million in the tails. It is not in the Senate position. The House has got the governor's EIDBI rate for American Indian, culturally responsive rate, is not in the Senate position. On line 369, the House has got picks up the governor's recommendation for SUD access implementation and the 1115 demonstration compliance item that is not in the Senate position. Line 377 is the governor's item for retaining and expanding children's inpatient psychiatric and PRTF beds. That has got funding of $10.3 million in 22-23 and $15.6 million in the tails. It is not in the Senate position. Line 384 is the Reducing Disparities and Healing Communities initiative in the governor's recommendation dealing with the opiate epidemic. This has expenditures of, I should say there's net expenditures of 2.6 or 2.5 million in 22-23 and 4.9 in the tails. Part of that is from the opioid epidemic response fund. Most of it is general fund. That is not in the Senate position. On line 395 is a piece that is related to the opioid bill that was just discussed that was passed off the House floor on Friday, I believe. So that is no longer relevant. This funding was in the bill, but is not needed here anymore. Line 400 is the opioid treatment program rate integrity recommendation of the governor, which the House has and is not in the Senate position. At the bottom of that page is on line 410 is a children's mental health respite care item that I skip over that. That's a governor's position that's not in either bill. On page 7 of the spreadsheet, line 423 is the self-directed collective bargaining agreement changes. The House has got 8.3 million for that and 486,000 in the tails. It is not in the Senate position. Line 435 is the governor's major workforce revitalization initiative. The House has got much of the governor's item, but it's not quite the same. The House is spending $156.5 million in 22-23 and 82 million almost in the tails. The Senate has a different, the same item but different spending of $32.2 million in 22-23 and 153 million in the tails. Moving down to line 460, there is a Senate-only item, the residential settings closure prevention grants. The Senate position is 6.2 million in 22-23 and 12.3 in the tails. The next item on line 464, also a Senate item, is a rate increase for disability waiver DWRS services. That is, got a cost on the Senate bill of $11.2 million in 22-23 and $241.8 million in the tails. Going to line 471 is a rate increase for nursing facilities. This is a Senate-only item again. It is $56.9 million in 22-23 and $168.1 million in the tails. At the bottom of page 7 is another Senate-only item on line 478. This is the rate increase for non-emergency transport providers of $5.4 million in 22-23 and $12.7 million in the tails. And moving on to page 8, on line 488 is an item that is the same for both House and Senate on the funding. This is a fuel rate adjustment for NEMT providers. The House and Senate spend the same amount of money on that in all across the board. On line 496 is a Senate provision for a rate increase for home care providers, which has a cost of $14.9 million in 22-23 and $75.1 in the tails. On line 503 is a Senate-only provision for a rate increase for homemaker services that spends $961,000 in 22 and 23 and $6.9 million in the tails. That's a Senate-only item. On line 511 is the Senate's item for a premium reduction for the MAEPD program, which has a cost of $2.8 million in 22 and 23 and $6.2 million in the tails. Again, Senate only. Line 514, the Senate is carrying an item which is not got costs on, is a net zero item in the spreadsheet, which is repurposing unexpended SILS grant funds. The hashtags indicate that that's in there, but has not got costs. The lack of any hashtags on the House side show that that's not in the House position. Line 516 is Senate's item to repeal DT&H county grants, which reduces spending by $811 million a year, a Senate-only item. The line 520 is the community organizations grant item. This is again a Senate-only item that has a cost of $100,000 per year from 23 on, not in the House position. 524, line 524, is the Senate position for a grant to the Wellness in the Woods, which has got $100,000 a year beginning in 23 and through the planning horizon. On line 528 is a grant to a Rochester nonprofit recovery community organization. This is a Senate-only provision that spends $53,000 in 22-23 and $110,000 in the tails. On line 532 is a grant to a recovery community organization in Olmsted County. This is also a Senate-only provision. It spends $100,000 a year beginning in 23 and through the planning horizon. The line 537 transfers the fetal alcohol syndrome grants from DHS to MDH. So there you'll see a negative in the tails as that grant is moved out of DHS. That's a Senate-only provision. Line 540 is another item the Senate has in that has a net zero cost listed on the spreadsheet, is not on the House side. On line 542 is the Senate-only item on the medical gas manufacturer's fee reduction, which is related to the the whole opioid settlement and statute on that. The Senate has that, and it will appear elsewhere in the spreadsheet when we come to it. The House does not carry that item. Line 546 is the governor's recommendation for the Direct Care and Treatment Electronic Medical Record Initiative. The House has the same spending as the governor, $8.9 million in 22-23 and $7.7 million in the tails. The Senate does not carry that item. Moving on to page 9, on line 552 is a governor's recommendation for MA eligibility for former foster care youth. The House picks up that initiative. It is not in the Senate position. On line 556 is a governor's item for supporting tribal providers and payments. The House picks up that item. The Senate does not carry that position. On line 562 is the governor's recommendation for responding to COVID in Minnesota healthcare programs. The House carries that item. The spending is not quite the same in the House as it is for the governor. The House spends $9.5 million in 22-23 and $3.7 million in the tails on that item. The Senate does not carry that item. On line 574 is a recommendation that was in the governor's budget, and the House picks up to remove the doula supervision requirement. The Senate does not pick that up. On line 579, there was a governor's recommendation regarding clarifying Minnesota healthcare programs enrollee error overpayment language. That is a net zero item. The House does not carry that, and neither does the Senate. It's hard to tell on those items since there's no cost listed, but that's why it says no on the spreadsheet on the House section. Another item, net zero cost item, is on line 582, which is ME coverage for vaccinations administered by pharmacists. That is in the Senate position, not in the House position. On line 587 is the governor's recommendation for enhancing Minnesota healthcare programs COVID vaccination rates. That is not in either the House or Senate positions. On line 593 is the governor's recommendation for costs of supporting drug pricing litigation. The House picks it up. The Senate does not include that item. On line 601 is the governor's recommendation for continuous eligibility, MA eligibility for children under age 21. The House has that, and the cost is $1.1 million in 22-23 and $40.935 million in the tails. The Senate does not include that initiative. On line 610 is the governor's recommendation for increasing health insurance affordability. The House has a substantially reduced item and only includes what are referred to by the departments as the enrollee experience items. This is a healthcare access fund expenditure as well. That is $5.75 million in 22-23 and $4.3 million in the tails. Moving on to page 10. On line 623 is the House's provision for a Minnesota Care public option. This has a cost of $22.9 million in 22-23 and $62.784 million in the tails. This is not in the Senate position. On line 632 is the House's position to create a managed care opt-out in medical assistance. It saves $16.7 million in 22-23 and $9.975 million in 24-25. It is not in the Senate position. On line 646 is the governor's newborn screening initiative. The House includes that, the Senate does not. On line 561 is the governor's item for a grant to support urban American Indians in Minnesota healthcare programs. The House includes that item, the Senate does not. On line 657 is a House item to eliminate cost sharing in the medical assistance and Minnesota Care programs. This has costs in both the general fund and the healthcare access fund. The total cost is $13.7 million in 22-23 and $71.3 million in the tails. On line 666 is the House Dental Services item, which has a cost of $8.8 million in 22-23 and $43.2 million in the tails. Again, that one is, the net number is from both the general fund and the healthcare access fund. The Senate does not include that item. Line 678 is the governor's item for background emergency studies credit, which the House includes. The Senate has a different approach to that, and we'll come to the next item is the Senate simply eliminates duplicative background studies, and that position is not the same as the House or the governor. So similar items, but dissimilar approaches in funding. On page 11 is, starting on line 693, is the governor's item for service delivery transformation initiative. This is the large IT initiative, which the House does include for $77.5 million. The Senate does not include this item. On line 701 is the continuous and improvement and compliance initiative from the governor. The House does include this item, the Senate does not. On line 712, there is a net zero item on codifying emergency shelter improvements. My understanding is the Senate includes this item, but the language is different than the governor or the House. Okay. Moving on to line 715 is, I can skip that, that's the governor's cannabis item. Line 726 is the net interaction with child care changes. The various program changes have individual costs, but together they have an additional cost. The House's set of changes have a savings of $24,000 in 22-23 and a cost of $21.4 million in the tails. The Senate does not have any of those items, so there's no net additional cost. On line 739 is the House item on a housing supports bed moratorium modification, which costs $2.3 million in 22-23 and $9.3 million in the tails. And on line 746 is the Senate's item for a housing support supplemental rate at a Douglas County facility. That's a Senate-only item. Then on line 749 is money for additional funding for emergency staffing pool. The amount is slightly different between the two houses, and the Senate includes language extending the availability of the funding longer than the House has it. Page 12, at the top on line 754 is a child welfare and maltreatment changes item. Members might remember this was in the House bill last year. It is not in the Senate position. Line 759 is the Employment Exploration Services Base Wage Index. This is identical in both the House and Senate on funding. On line 764 is a House-only item that makes changes to the CDCS disability waivers rate. It's a 2.8% increase to the CDCS part of that rate, which has a cost of $2.96 million in 22-23 and $15 million in the tails. The Senate does not have that item. The House has on line 768, a community residential settings service termination protections item, which has a modest cost and is only in the House, the Senate does not have that. There's a related provision to this at the Ombudsman for Mental Health DD that will come to provide some staffing for them for oversight in this area. Line 773 is a bill that it begins the planning for the PACE program. It does not actually start the program, but begins the planning for it. This is a sort of a gold standard program on elder care, is my understanding. On line 779 is planning for a supplemental security income trust account program. This again starts the planning for that, but does not actually start the accounts. Line 788 is the House's elderly waiver rate framework item. That spends $7.996 million in 22-23 and $74 million in the tails. The Senate, if you move down, the Senate doesn't have that. The Senate in the next item has a elderly waiver rate framework implementation item on line 799. That spends $5.8 million in 22-23 and $111 million in the tails. And then the Senate has, in addition, on line 807, the elderly waiver rate floor item, which is not in the House position. That costs $3.3 million in 22-23 and $13 million in the tails. On line 812 is the House-only item for a delivery reform analysis study, not in the Senate position. On line 819, the House moves the MA excess income standard for elderly and disabled to 133% of federal poverty level and changes the asset standard to $20,000 for individuals and $40,000 for couples on July 1st of 2025. That costs $76.6 million in the tails. The Senate does not include that item. On page 13, on line 827 is the House item to include mammogram diagnostic testing in MA. It's not in the Senate position. To expand what is covered, I should say. And on line 832, the House has a position to cover ectodermal dysplasias. This was in, I think, one of the bills several years back and didn't get through. It's not in the Senate position. There you will come to an item at the Commerce Department down at the bottom of the sheet that is related to this. On line 838 is the House-only home care evaluation item. That's $4.2 million, $3 million in the 22-23 and 8.3 in the tails, is not in the Senate position. Going down to line 854, 853 is a Senate-only item for HCBS shared services. And going then to line 857 is a House-only item on HCBS shared services that includes a support coordination training grant. The approaches are different and the amounts are different. Then down to line 865 is a Senate-only item that modifies the sub-minimum wage task force. The House does not include that position, but below that on line 870, the House has a position adding 4 members to the sub-minimum wage task force. On line 875 is the House includes a rate study for ICFDDs On line 881, the Senate includes funding for an ICFDD rate floor, which is 5.8 million in '23 and 27.5 million in the tails. On line 885 is an item where the House and Senate have it, well, almost identical spending, the Quality Parenting Initiative. The House spends the same amount in '23 as the Senate. The Senate's money is ongoing. The House does it one time. On line 889 is an item the House and Senate carry for the Minnesota Association for Volunteer Administration. Again, the House has a one-time expenditure in '23, and the Senate has a lower grant but ongoing so those are similar. On page 14, line 893 is the SNAP income limit modification. The House has got the costs included. The Senate has a different approach. On line 898 is the Senate's life sharing services development, which also, I believe, begins implementation. The House has a different approach, which is on line 905, which develops the life sharing services, but does not start the program. That's on line 905. On line 911 is the House initiative on supportive decision-making. This is a grant to a nonprofit. The Senate does not include that item. On line 918, the House has the Direct Care Service Corps. This, again, is a grant. The Senate does not include that item. The House on line 923 includes the CEMIG and peer mental health specialist item. This is $15 million in 22-23 and $20.3 million in the tails. The Senate does not include that item. On line 928 is a House-only item on emergency shelter facilities grants. This has a cost of $75.4 million in 22-23 and $930,000 in the tails. That's not in the Senate position. Line 935 is the House's position on additional emergency services grants. 36.3 million in 22-23 and 18.9 million in the tails is a House-only item. On line 942 is a House-only item for Homeless Youth Act grants, which cost 10.1 million in 22-23 and 20.2 million in the tails. On line 549 is the House Safe Harbor Initiative. Adds 5.6 million to that program in 22-23 and 11.2 in the tails. On line 955 is the House Transitional Housing Grants Initiative. That is 2.6 million in 22-23 and 5.2 million in the tails. On page 15, beginning on line 961, is the House's Shelter Link Mental Health Grants Initiative. That's a House-only item. On line 967 is the House-only income asset limitation item. On line 974 is the House's Hennepin County homelessness grant item. On line 979 is the House's Ramsey County Continuum of Care homelessness item. On line 983 is a House-only item on clinician-administered drugs. Senate does not cover that item. You heard before, I think Council mentioned the intractable pain definition is in both bills with, I believe, some differences. it should not have any costs in the spreadsheet, although I understand there's some discussion about exactly how the language should work, but it doesn't show any costs. On line 994 is the house-only initiative on foster care costs to families, eliminating foster care costs to families. It has a cost of 5.1 million in 22-23 and 230,000 in the tails. That's a house-only initiative. On line 1001 is the House initiative on behavioral health home modifications. On line 1008 is a house-only item starting MA coverage for children's hospice respite care. On line 1013 is a Senate-only provision on market rate for respite services. On line 1018 is a Senate-only item on background studies and certification for out-of-home child respite care. On line 1024 is a Senate-only item on long-term care decision reviews. On line 1028 is an item that is the same for the House and Senate that includes driving as a covered service in the PCA program. Moving to page 16 on line 1034 is a Senate-only item that creates an enhanced rate for high-needs PCA recipients. The House does not have that item. On line 1041 is an item that the House and Senate have, I believe, identically, which relates to PCA hours covered for parents and spouses in the program. On line 1047 is a Senate-only item on community residential settings and conditional approval of planned closures. That is not in the House position. On line 1052 is the Senate-only position on adult overnight supervision changes. On line 1057 is a Senate-only provision related to financial management services. On line 1062 is a House-only provision creating a dental home pilot program. On line 1069 is a House provision related to coverage of HIV prevention, PEP and PrEP medications and getting rid of copays, and for those, that is a House-only provision. On line 1074 is House coverage in MA for for seizure devices and seizure detection devices. And on line 1080 is a House provision on IRTS services, intensive residential services modifications, which is not in the Senate position. On line 1087, the House begins coverage in MA for tobacco cessation treatment drugs. That's House-only provision. On line 1093, the House provides coverage and medical assistance for long-acting reversible contraceptives. On page 17 at the top on line 1095, the House says funding for a disability services task force. On line 1104 is the House-only provision on a youth homelessness prevention pilot program. On line 1112 is a House-only provision for a grant to an African-American mental health center. On line 1118 is a House-only provision for children's residential crisis standard. On line 1128 is a House-only provision on children's residential treatment. On line 1134 is a House-only provision on children's first episode psychosis. And substantial item on 1140, the House is recognizing the next quarter of enhanced FMAP payments for the federal government. We are within the period now, the federal agency has said that they would give states 60 days notice before ending the public health emergency. That 60 days now carries us beyond July 1st. And it has been the federal government's position that if you have the public health emergency in place for 1 day of a quarter, we get enhanced FMAP for the entire quarter. So the House is recognizing net $239.5 million in general fund and some healthcare access fund changes in 22-23, and then that has a cost of $10.3 million in the tails. The Senate does not include that position. And then the next one on line 1146 is an item that we have used, the governor and the House and Senate have all used to balance our general fund numbers to target using appropriations to healthcare access fund, or to the medical assistance program in healthcare access fund.
Well, thank you, Mr. Berg. I did check with the Fiscal Analysts Union, and you're only allowed to go 45 minutes without taking a break. So thank you very much for that. And so that was actually very good. You got through a lot of material in a reasonable amount of time. So I think we're going to save the Department of Health for another time. I would like to have a little discussion now, if we can. I have a question, and then Representative Pinto has a question. I think Senator Kranz and Benson have something, and then we'll kind of come in for a landing here at some point. Mr. Berg, with that FMAP, I see that's a negative.
Yes, it's.
So that would have the effect of reducing the cost in the bill by that amount.
Yes.
And so the net cost, so is it really, do I have to 2 times it to get, like the governor has $1 billion and $2 billion nominally, and you're about at $2.5 billion over the 3 years?
Mr. Chair, I think what you're asking is what is the spending number without savings?
Right.
And I don't know that exact
Okay.
number, but you're correct in that we are saving $240 million in
Right.
2 funds, which get us to our net $779 million of general fund spending, so.
All right. Yeah, thanks, I got it. Representative Pinto has a question for the department.
Thank you, Mr. Chair, and I really appreciated you, Mr. Chair, coming over and, now, do I need to, says I'm supposed to, okay, I don't need to touch anything on this Zoom.
Don't touch
Again,
anything, yeah.
House member, trying to get accustomed to the setting here. I appreciate you, Mr. Chair, coming over and pointing out the section on the spreadsheet, and for those who are following along page 7, in particular, towards the bottom is an area that highlights the Senate's investments in nursing facilities and others. And I guess the question that we kind of talked about, but I wanted to raise, was the extent to which there are increases that are automatic without any legislative action. And if that is, I gather the spreadsheet simply reflects additional spending on top of the additional spending that occurs automatically. And if we can maybe get information the next day or two about those areas. I know we'd said that DWRS and nursing facilities both have automatic inflation increases. I think PCAs don't. I know that childcare does not. I think provisions against homelessness don't. If we can just understand which ones do, which ones don't, and what the impact is of those automatic increases. I think I have information that include the federal match. It's about $730 million in annual rate increases, sort of at minimum for nursing homes without any action on our part. And I want to make sure it's understood that that's an area that is incredibly important, critical services, allowing people to live in dignity, not being paid nearly enough. So there's absolutely a need to do that, and also to do, I just want to make sure throughout this process over the next couple of weeks we're applying a similar standard across the different areas of spending. So anyway, so any thoughts on that or information if we can get in the next day or two? Thank you.
So, Mr. Burdick, would that be you that would be accepting that request and then sorting it out?
Thank you, Mr. Chair. Matt Burdick with the Department of Human Services. Yes, I can work with my fiscal colleagues, and we'll pull that information together for the committee.
Yeah, thank you very much. Senator Benson.
Thank you, Mr. Chair, and Mr. Burke. As we went through the spreadsheet, I didn't notice any asterisks. Are there any items that have significant changes off spreadsheet that we should take note of?
Mr. Berg?
Mr. Chair, Senator Benson, there's nothing that's noted on the sheet, but there are numerous initiatives, more in the House and some in the Senate, that have growth in the, beyond the tails, the DWRS initiative, nursing homes. There are a number of those. In the House, I would probably note the changing the MA excess income standard in 25. That we show the full cost in 25, but that would be double that at least in 26 and 7. Both positions, I believe, in the Healthcare Access Fund are subject to question in 26 due to reinsurance.
Senator Benson?
Mr. Berg, and we should assume everything on the spreadsheet is added to the base unless otherwise noted, or how would we differentiate between those items that are one-time or only for the 3 years? Because I know there were a couple of spreadsheets that we've looked at in other areas that are only 3-year numbers.
Mr. Berg?
Mr. Chair, Senator Benson, it is part of the budget rules between the House, Senate, and the executive branch that are signed off on, that if something appears in the second year of the biennium and it does not in the language say that it is one time, it is assumed to be ongoing. There isn't anything in our spreadsheet there are no notations like that because there isn't anything where we're doing that I'm aware of. I mean, there are numbers in the sheets for all the ones, if it's in 22, 23, or 23, 24, 25, it's 3 years. And if in 25 it's there, it's an ongoing expenditure, unless the language says it's not, which I do not recall that there are any of those, but I could be wrong.
Thank you. And
Senator Benson?
Mr. Chair, as bills went through the Finance Committee, we were attentive to those that were one-time funds or time limited. And so I don't need to make a lot of work for items that we're not going to adopt, but it would be helpful if fiscal staff, as we're going through, could help us note if there are any that are 3-year numbers.
All right. Senator Cran?
Thank you, Mr. Chair. Mr. Chair, looking through the, getting this large amount of data late, I'm looking at the kind of the focus and growth in government. Do we know between both the House and the Senate plan, and can somebody on the call tell us what's the growth or the proposed growth in FTEs in both the House and the Senate plan? Is there anybody online that can do that? Or is
Mr. Berg, do you know?
Mr. Chair.
You are the math guy.
Senator, I can tell you for the House position. I can't tell you for the Senate position.
Please do.
In the House position, the Department of Human Services says that the FTEs in the House bill are 215 and 23, 222 and 20, 223 and 24, and 237 and 25. Those are not cumulative, so an FTE that's permanent is 111. So that's, you don't add them up to 600 and some, it's 200 and some a year. The MDH numbers are 213 and 23, 204 and 24, and 195 and 25.
Senator Cran?
Thank you. Mr. Chair, does anybody have the Senate number?
Mr. Albrecht, how are you doing there? Is that a number you know, Mr. Albrecht, or could you get that for us tomorrow or whenever?
Mr. Chair, that is not a number that I know. And yes, I can get it.
All right. Thank you very much.
Thank you, Mr. Chair.
Senator Cran.
Mr. Chair, along with that, I would hope that we'd focus on, as our conversations move on and we've walked through and seen the stark differences in our bills, I think there is some common ground in the, when we look at nursing homes, group home, PCA services, childcare. I think those all fall into the critical need category of what we should be looking at. I really don't believe, I think we should minimize any growth in state government. Every one of those dollars should be put towards people that actually provide service to the community in those critical areas. I think the wage increases, all those are necessary. But I think, as we all know, those markets or those industries were on a rough path prior to the pandemic, and it's accelerated maybe 3-5 years. But one thing is when we're talking about the dollar amount, and it's been our consistent focus, I think the agency and the rules and the policies have been further detriment to the entire process throughout, and it pushed people away. So I hope when we look forward, we put the short term, look at the critical need, but I think at some point we're going to have to really revise the policies that hinder care, right, enhance neglect, lead to early death and or horrible living conditions. That's not going to rapidly change unless we actually do something different. The funding's going to be great, that we can look at it and to say we have hope, but it is just hope without drastic change. And so I don't see adding any more overhead to the agencies throughout the life cycle of what we provide. That it degrades the value of every dollar that goes to our providers, the frontline private companies, the nonprofit, for-profit entities who actually provide the care. It's critical, and it's not going to end anytime in the next decade as far as the need. I'm a baby boomer, so we're the end of it. That need, we can count on the silver tsunami, but we're all part of it. And we put them in a really tough situation. So we're going to have to do dramatic transformation of those agencies, as well as the rules and policies in which will free up and allow the creativity necessary in the private sector to provide great care. Because to me, in my perspective, it's the only other reason for government is our children, our disabled, and our elderly. So I hope we would focus on that. Thank you, Mr. Chair.
And Mr. Burdick, since you have like so much free time, is there some way to decide or let us know how many open positions are at DHS? And Ms. Timjohn, how many open positions are at MDH as you propose? I presume these numbers match the governor's, perhaps there were more in the governor's, that there's a way to attract those individuals. But I'm just curious how many open positions you have in both those places, and that could just be part of the same commentary. So I'm going to offer a thought, and then I'm going to let, yeah.
I had one
Senator
more.
Benson.
I had one more question on my list that would be helpful information. The direct care and treatment electronic medical records. I feel like that's been going on a long time. And Mr. Burdick, I don't know if you're the right person to ask at the department, but could you help us understand when that was started and how much money has been spent, state and federal funds? I know there was a good amount of federal funds drawdown for that, but I feel like it was started before 2017, and I'd just like to get a sense of how big that project has gotten.
Thank you. Absolutely. I'm going to call on you in a second. You can tell us about tomorrow and say whatever else you want to say. I just want to offer my own thought about the surplus. Just the gospel according to me. I don't think the surplus is anything approaching $9 billion. If the November forecast could be known, I think we would have our teeth fall out of our head. Diesel in Coon Rapids yesterday was $5.29. And, can't get formula and everything else. So I just want to caution people, for my 2 cents worth, that we just need to be really prudent and deal with things that are critically urgent and that we really have to do. There are people know me, there's many things I'd like to do. I'd love to do the spend down to 133 and even, just be done with it. And things like that. But I hope that as the process wears on, that we can be prudent and mindful of the situation that really is ahead of us. Anyway, so I'll leave it at that. And tomorrow, Representative Liebling has the gavel, and with that in mind, Representative Liebling, what's on store for tomorrow?
So thanks, Senator. And I'm just going to, I think we sent out what we're going to be talking about tomorrow. We're going to be starting out with some of the Department of Health items that are more House-only items and get through some of those. But I just want to make a couple comments real quick because I know we have to get to session. First of all, they're on the spreadsheet. There are only a couple of items that I saw that are savings items. I know the Senate has a small savings item. We're getting rid of a grant that I think is probably no longer necessary. The House has one savings item, and that is the managed care opt-out. Giving people a choice about whether to be in managed care saves a bunch of money. So And this is, just a beginning. So I just wanted to point that out. I have a particular interest in that, as many people know. The other thing is, when we talk about critical need, I think we all recognize that we need to focus on needs. And I think it's, what you think is a critical need kind of depends on what your need is, or the need of your constituents, or the need of the people that you know. So, I don't disagree with Senator Coran about that we have, there are a bunch of needs across the state. And we do want to make sure that we focus our efforts where the needs are. That is for sure. And but there are also items in here, by the way, sometimes, as every business person knows, sometimes you have to invest money to save money, as in upgrading our technology and things like that. So I don't want us to overlook those that we have some money right now, and the time to make those changes so that you can be more efficient in the future is when you have the money, and we have it right now. So I hope we keep that in mind. And right. And then I just do want to say too, as we think about the challenges that people have, and they are very real challenges, the formula, the supply chains, all of these issues, the gas prices, there's a huge war. Russia has attacked Ukraine. I'm sure I don't have to tell anybody this. And that comes on top of all of the supply chain issues and things that are worldwide crises that are very serious crises. But if you're a person who's living on the street, you've got a big crisis, and that's a critical need right there. So I think we have to be mindful that critical need is in the eye of the beholder. So with that, Mr. Chair, I'm going to hand it back to you and look forward to seeing everyone tomorrow.
And so we're back at 1 o'clock tomorrow, is that right, Representative Liebling?
Yes, and we will be virtual.
Right.
Meeting virtual.
And I think we might still be here in this room, but it's my intention to have this room open for people who, we're not allowed to have popcorn in the Senate, unfortunately, they can have popcorn out there? There you go, folks. Anyway, and by the way, the mental health bill is, just talked about that at one of the breaks here, and that's moving, and where that winds up, nobody knows. Thanks for your attention. Enjoy the day. God bless. We're adjourned.